So I have a lot of experience with limp penises that are because of psychological circumstance more than physiological. And with that, you just want to be like, okay, that's fine. We don't need your penis. We can do other things. We can have fun with a limp penis, actually. Like, there's all sorts of stuff that can happen. But when it's because of a medical concern, you want to address that.
Yes, for sure. And so, let's address it.
Great. Let's hear our first letter.
Dear How to Do It, I'm a heterosexual man in my 30s. In July of last year, I contracted COVID and was very sick. When I got out of the hospital, I had some erectile dysfunction issues. Those gradually got better with some medical attention, but I seem to be left with a lasting problem. My penis has shrunk. Before I got sick, I was above average. Not huge, but definitely bigger than normal. Now I've lost about 1.5 inches and become decidedly less than average. It's apparently due to vascular damage, and my doctors seem to think it's likely permanent. It shouldn't really matter, but it has had a profound impact on my self-confidence and my abilities in bed. I know you can't give me back my missing length and girth. I was wondering if you could give me any advice on what to do now. Signed, Coming Up Short.
Because there's so much that we don't know, I thought maybe we should reach out to an expert or two.
Awesome.
And so I have this urologist, Charles Welliver. He is the director of men's health at Albany Medical College. I use him a lot for my penis and urology related questions, and he has graciously agreed to speak with us. We just talked to him about COVID dick, and is it a thing?
So yeah, you can connect these dots actually. So, one of the things that we know about COVID is, of course, the massive respiratory symptoms that leads to a lot of the deaths, but there's also pretty significant vascular issues that occur with guys. And studies have actually shown that both guys can get priapism, the prolonged erection that's dangerous in its own right, and the guys can also get ED from getting COVID. So it can kind of go both directions with these vascular events. But when guys get ED, they get a lack of good erections for a while, right? That's why it's defined. But when that happens, they actually do get some shrinkage. We do know that guys get some shortening. So you can kind of connect the dots through that.
How prevalent is guys who experience ED post-COVID, and B, people who have ED who then see shrinkage? Is this common in either designation?
Probably every guy that has significant ED, not like a every so often type of problem. Every guy that has significant ED probably gets some shrinkage. And we see that particularly in guys after they have their prostate out for cancer and they have like zero erection for 6 to 12 weeks. They all get shrinkage. And there's actually some things you can do to rehabilitate that. But to answer your other question, we don't know what kind of the total number of guys that have had COVID at this point is, because so many people are asymptomatic. But I can't say I've seen like a lot of guys for like guys with ED after COVID. I wouldn't say it's really, really common, but it's certainly a possibility.
So you said something a minute ago about rehabilitation. Can you give us some more information on that?
So the concept of rehabilitation actually started after radical prostatectomy because they knew that guys had this temporary loss. So the original stuff was to try and use like a low dose daily Viagra or something along those lines. But more recently, we've started to look at different kind of stretching devices or traction devices. There's one called Restorex, which is used that the data is actually very good on about regaining length and maintaining length. And there's other ones called vacuum erection devices, which have been used for ED for forever, which also have some potential benefit there too.
Yeah, our writer said, I know you can't give me back my missing length and girth, and it sounds like actually there might be a way to get some of that back.
There is very good data that shows that is possible, so I hope he's listening.
So I also reached out to an expert, Ashley G. Winter, who I found through Twitter, and she had so much to say.
She's a woman urologist, which is very rare and fascinating in itself.
10% of urologists are female.
So we've got a unicorn on our hands.
Yes, I love a good unicorn. Do you know anything about COVID dick shrinkage?
Yeah. Okay, so in terms of why there are negative effects of COVID on the penis, right? The main reason that we think this occurs is something what we call endothelial dysfunction, and I'm using like jargon words here, but that's basically the cells that line your blood vessels. They're like smooth muscle cells, and they line your blood vessels, and they're really important for the function of many different organs. And COVID gets into those cells, and so that means it affects many different organs in your body, not just your lungs. And because the erection is, a blood flow event, right? You get hard because a whole bunch of blood moves into your penis and stays there. When those blood vessels are affected, then you can get the erectile dysfunction. And there's actually a really cool study that was done by some urologists in Miami, where they took samples of penis tissue in men who were undergoing a penile implant surgery, and they looked for COVID in the penis, and they found COVID virus particles in people's penises. And this was after they had completely recovered from the disease. So we totally know that COVID dick is like a real thing, and people aren't just like making it up. Like the COVID is actually in your dick.
Is there like a sexually transmittable COVID risk that we should be concerned about?
It's not considered to be transmitted through sex. And actually, they have found COVID in the testicles. They have shown impaired testicular function after COVID infection, meaning, it could cause your testosterone to go down. It could cause, reduced fertility. And actually, this is another cool thing. There are studies comparing men before and after COVID vaccination and looking at their sperm parameters. And there was absolutely no negative effect of COVID vaccination on sperm parameters. So that's another reason to convince people to get vaccinated, because it's also bad for your balls in addition to your dick.
But it can't live in their balls for weeks after recovery and then be like, surprise, you've got COVID.
It can live in your balls for weeks afterwards, but is there a case, right, of somebody who went around and had sex with a bunch of people after they had COVID and gave them all COVID? Absolutely not. So no.
When we talk about the effects of COVID, is it too early to say whether these resolve over time or are permanent?
It does appear, at least with the testicles, that the negative effect is not permanent. The amount of time that it will take afterwards to get your testicular performance or balls working the way they should, can probably vary, but you imagine it would be somewhere on the order of months. With the penis, I don't think that's been well established. The problem is that if you do have erectile dysfunction that's really profound for a period of time, there can be some of these what we call more permanent effects, right? So, this guy is saying that he has shortening. It is true that having erectile dysfunction leads to shortening. Now, there are types of ED, for example, performance anxiety related erectile dysfunction, that don't lead to penile shortening. And the reason is because even if you get nervous and you lose your erection, but your penis is otherwise healthy, right? Like the blood vessels in your penis are healthy, then when you go to sleep at night, you're going to have nocturnal erections, or you're going to masturbate and have nice erections. So that is really important actually for the health of your penis, to bring the blood flow in, to stretch it out, and kind of that maintains the length and girth and health of your penis. So people with that type of ED are still getting full erections at some point, whether or not they realize it. Now, if you have a real physical erectile dysfunction, a classic example is men after they've had their prostate removed for prostate cancer. Somebody who has erectile dysfunction from COVID, they may also have this very physical type where possibly they're not even getting a full nocturnal erection, right? So you have this period of time where the penis is not stretching itself out, where it's not getting all this full blood into it. And that can lead to scarring of the penis and shortening of the penis. And that's probably what, your caller is referring to. Now, there are things you can do to help with this. So there's a really common concept of penile rehab, and that's done for men, or prostate-bearing individuals who have had prostate cancer surgery, so that they don't lose length and have scarring during that period of erectile dysfunction, so that when they come back to getting their erections, that they maintain their penis length. And how do they do that? So a typical regimen would be, starting something like Viagra or Cialis soon after their surgery or even before it, again, to improve blood flow. Another thing would be to buy a penis vacuum device. and do kind of what we call, penis exercise with it, or penis push-ups. And that's where you just take the vacuum device. And sorry, these are, really commonly when you think of them, it's used, for sex. And what happens is people put a constriction band, aka cock ring, at the base of their penis, and they put the vacuum device on and they pull blood into the penis, make it hard, and have sex. But if you use it for penile rehab or, penis exercise, you don't use the constriction band. You just put the thing on, suck blood into the penis to stretch it out. Those are two options. And then the last thing is using traction, and that's essentially you buy a device that you put on your penis and it holds it in stretch. The one that I recommend to most patients is one called Restorex. I have absolutely no financial relationship with them, but it's a great device, and they actually have their data on their website. And they show in men with shortening of the penis from erectile dysfunction or other, kind of chronic disease, that they can have improvement of penile length by, 1 to 2 centimeters with consistent use of this sort of thing. So these are easy things you can do at home to either prevent shortening or actually get back the length that you've lost.
So let's say our guy is like, I don't want to take pills. This machine thing weirds me out. I'd rather just come to terms with my new penis dimensions. Do you have any advice for him on how to become comfortable with his parts as they are?
Totally. So, if you look at the literature on people who are unhappy with their penis length, there's actually studies on this. In those same studies, they show that the partners of those people are very happy with their penis length, right? And so, in general, and I know this is a message you would agree with, being a good sex partner really doesn't have anything to do with your penis length. I mean, it's just how responsive you are